Here is our host, Tian Wei.
Hello and welcome to World Insight on CGTN. I'm Tian Wei in Beijing. We start with the good news. The Global Vaccine Summit, hosted virtually by the UK on Thursday, raised $8.8 billion for routine vaccinations in some of the world's poorest countries. British Prime Minister Boris Johnson announced the figure at the end of a 3.5-hour online session. Chinese Premier Li Keqiang, along with officials from more than 50 countries and regions, attended the virtual meeting amidst the current COVID-19 pandemic. The Global Vaccine Summit raised funds for a Global Alliance for Vaccines and Immunization, also known as GAVI. It is a UN-backed alliance supported by joint efforts from government and private sector to help get vaccines to developing countries. Chinese Premier Li Keqiang announced China's donation of $20 million to the program.
China has enjoyed good cooperation with GAVI. The alliance helped fund a program in China involving expanded vaccination and international application of vaccines. To meet the challenges of COVID-19, I am pleased to announce that the Chinese government will make a contribution of $20 million to the GAVI funding for the period 2021 to 2025. We will also encourage Chinese research institutes and vaccine producers to collaborate closely with GAVI and support its important role in promoting vaccination coverage.
About GAVI, a few weeks ago, I sat down with the CEO of GAVI, Dr. Seth Berkley. He praised China's swiftness on containing COVID-19 and sharing the genetic sequences only 2 weeks after observing outbreaks. He gave his opinions on how governments around the world could work together to accelerate the R&D for COVID-19 vaccine. Let's listen in. Compared to Ebola, the outbreak of Ebola about 10 years ago, now you see the world has been a little bit different, to say the least. Geopolitics and politics, nationalism, things like that. I don't want to throw the big words here, but the reality is that once the vaccines are being made, tested, and can be put into the market, whether the world will be able to share it or it's likely to be nationalized by whichever country.
Well, of course, I think nothing talks about the importance of having a global view as this particular outbreak does. We need to understand that any infectious disease, anytime, can do that. But second of all, we also need to understand that the best ideas, the best technologies may come from any of the different countries, and it may come from multiple countries. We may have a vaccine from one country, an adjuvant, which is a stimulant to make the vaccine work better, from another country, and a manufacturing from a third. So from my perspective, we need to think of this as a global solution. The other issue is that we don't know in 18 months where the epidemic will be, and therefore the vaccine needs to be made available wherever the epidemic is, because if we have large groups of people in the world with an uncontrolled epidemic, it threatens the whole world because it can reintroduce, as we saw it happen in this case. So, you know, from my perspective, science is global, and so does this response need to be. Of course, every country wants to make sure it has access of the appropriate tools for its citizens, but it can't only be for its citizens if it wants to make sure these epidemics stops. It has to be a global perspective.
One has to bear in mind that even for organizations like yours, there are major fundings coming from certain countries or from A country or country B. Will that have an impact on your decision and the way of doing things? Will that put a limitation on the kind of cooperation you could have with either countries or organizations or individuals?
So I think the wonderful thing about the multilateral system is that we receive funding from all of the G7 countries, but we also receive funding from all of the BRICS countries. And, we're working with a wide range of supporters. And so there is a governance mechanism that obviously each donor has a voice in. And each companies, because we also work with vaccine companies across the world, both in developed and developing countries, and obviously working with many recipient countries, they all have a voice in the governance mechanism, but nobody has a controlling voice. And so the idea here is that we work for the good of the world. Of course, from time to time, we will be going out and asking for more money, and we're in a replenishment period now. We fund ourselves every 5 years so that it's not about every time something happens, you go out and ask for it. It's rather, how do we build a system that can operate for the good of the world continuously over a time period and adapting?
If politics is not a problem here in this issue, what about money? I mean, now we've seen pharmaceutical companies that have been running against the time to develop the vaccine. We also see labs active around the world trying to do their work in this regard. But once the vaccine is being developed and also produced, will there be killer price for them? And will people be able to afford them?
So, first of all, I didn't want to imply, if I did, that politics is not at play. In an epidemic like this, of course, there is going to be politics at play. What I'm saying is that the importance is to isolate the truly global mechanisms and make them be driven by science and not politics as much as possible. In terms of finance, I do think the world will need to step up, because I think one critical question is going to be, how do we manufacture large amounts of this vaccine, because there'll be enormous demand for this, both from places that have acute disease, but also from the worried well. And so we need to make sure we'll have adequate quantity of the vaccine to be able to use it to control the epidemic. My own perspective is that vaccines are a global public good. Most countries provide the basic vaccination for their children, and it's not done by being paid or in a commercial market. Of course, companies are involved and they make profit in it, but the purchaser is the governments. That's true in China, it's true in the United States, it's true in Europe and most of the world.
Last question before we go. As someone who has been working on vaccines, looking at epidemics developed at different stages at different times, what do you worry the most? And what would you suggest is the solution for those who are watching our interview today, Dr. Berkley?
Well, of course, at the end of the day, I worry that we have the best science making the products. But what I worry about, of course, is that a product that is not available to where it's needed does us no good. And that's the fundamental reason GAVI was set up, because new vaccines, the science is moving so quickly and so well, but these new vaccines weren't available to people who needed them the most, those living in the poorest countries. And that was because of cost barriers and systems barriers. And so we worked to try to solve that. And as I've said, have been quite successful. But we know it is evolutionarily certain that we will continue to have outbreaks of infectious diseases. President Xi has said this as a priority for China. We need to be better prepared, but that's true for every country. So how do we put that system in place so that when a disease occurs, we have a vaccine as soon as possible and it's made available to those who need it? That's what drives me. And it's the opposite of that that would worry me, that we didn't make sure that we made these things available to everybody who needed them.
Seth Berkley, CEO of GAVI.